So you'll recall that we talked about the esophagus coming down and traveling through the diaphragm before it reaches the stomach. The stomach produces gastric juice, and this gastric juice has a low pH because of the presence of hydrochloric acid. Now, sometimes that hydrochloric acid gets up into our esophagus and creates pain and discomfort, and that is what we sometimes refer to as heartburn. When we talk about GERD, GERD is where heartburn is persistent and becomes a problem. So this is an acronym for gastroesophageal, so stomach, esophagus, and reflex means that the gastric juice is going the wrong way, disorder. So GERD. So if you have chronic heartburn, they will label it probably as GERD. So this gastroesophageal reflex disorder is diagnosed by endoscopy, a procedure where they take a endoscope, which is a little camera, and they put it down your throat and into your esophagus, and they can travel all the way to the stomach, for example. And this endoscopy tells them if there is if the acid is causing any damage to the tissues. So your lining of your stomach, or excuse me, the lining of the esophagus is not protective against the gastric juice. And so it can cause damage to this esophageal cells, and it can even lead to esophageal cancer, where inevitably they might have to remove some of the esophagus if you are diagnosed with esophageal cancer. So one thing that they might note when they do an endoscopy is whether or not your stomach is protruding above your diaphragm. And that is what is referred to as a hiatal hernia. So we sometimes think of a hernia like a piece of your intestine protruding through your body wall. That's a hernia. But the hiatal hernia is the protrusion of the stomach up above the diaphragm. So this would look something like this. This diaphragm actually helps to create the sphincter that normally would prevent gastric juices from getting into your esophagus. But here you can see that the lining of the stomach is actually above the diaphragm, and it's going to produce gastric juice, and there's nothing to prevent it from going up. So this is typically a reason for why people have GERD. And if we look at some ways to treat this, one way is using antacids. So these are just used to neutralize the pH. We could also use drugs that are called acid reducers. Some of these are what are called proton pump inhibitors. So proton pump inhibitors inhibit the release of hydrogen ions by these proton pumps, which are actually protein channels inside of the cells. So this would reduce the acid in your stomach, and this can be good because it can prevent acid reflux, but it can also be bad in that you could get bad bacteria coming into your stomach, and it could make you sick, and your stomach is not acidic enough to break it down, and also the digestion of very difficult things to digest, like say, for example, a steak, where you have connective tissue in a protein, and the acid actually helps to break that down so that the enzymes can work on it. So it takes longer for digestion of certain foods. We also have what are called H2 blockers, and H2 is actually histamine. And we talked about histamine when we were talking about inflammation, but also histamine is an important hormone that regulates the release of gastric juices. So if you inhibit histamine, which is spelled like this, you're going to decrease the acidity in your stomach. In recent times, the proton pump inhibitors have come under some controversy because proton pumps are not just in your stomach, but they're throughout your body. And in fact, they're super important in the production of ATP in the mitochondria. So some people are thinking that these proton pump inhibitors might be doing more than just affecting your stomach. So oftentimes they say not to be on them long term, although people are on them because they're over the counter for years and years and years. So also with the histamine blockers, they recommend not being on them long term, but people get on them and they are on them long term. So that's just something to think about. When we look at if this does not help, if these antacids and acid reducers and changing your diet and losing weight, for example, do not help any of this, there is a surgical procedure that they can do where they actually pull that part of the stomach down and then they wrap some muscle around it to hold it in place. And this works. Generally, it works for a while, but you might have to have this redone. And so generally that is if the other things that you do, like those acid reducers, don't work for you, then you might actually have a surgical procedure to treat GERD.